Hi everyone, back with Dr. Sara Gottfried. Going to talk about an interesting topic today. Hi Doc.
Hi, how's everybody? Hi Pedram.
Hello, nice to see you. So we got a lot of really good feedback from the endocrine disruptor segment that we did. And so I know it's been taking us a while to kind of get together and start these, but now we're going to be on a regular schedule with them. So I'm excited, and everyone out there is excited because I keep getting emails from people saying, hey, when are you going to do another one with Dr. Sara? And so here we are.
Here we are. Yeah, we are on the schedule.
So, one of the things that you and I have just chatted about, and it's a big deal in the media right now, is this whole breast cancer deal that's happening.
Oh, yes.
Angelina Jolie's out there doing preventative stuff and kind of taking a really bold choice for this. And so it's been all over the media. So I wanted to kind of tease it out today because it's obviously cancer is alive and well in a lot of ways, and it's been kind of picking up steam in a lot of places because of the toxic environment that we're in. But I kind of want to demystify some of the stuff that is out there and just talk about the science a little bit. Then we could talk about where people are at and where we get a bunch of questions too, so we could maybe field some questions later after the show.
Love that. And I'd love to start off with some stats. Just the fact that 1 in 2 Americans is affected by cancer. It's a little bit higher in men. It can sometimes average out to 1 in 3 women, 1 in 2 men, if you divide it up. But I agree with you. This is a big topic. Angelina really brings it to the surface because she's so glamorous, and she wrote the New York Times op-ed piece where she described this decision to remove her breasts prophylactically because of the gene that she carries. So I'm super happy to be talking about this today.
Fantastic. So, there's a lot of stuff, there's a lot of talk from on the establishment side, how this is, going to save lives and how this is, absolutely the way of the future. And then there's, talk on the other side saying, look, this is, super expensive, and the people that could afford it are the only ones that can get it. And, frankly, the people that are going to lose their lives to this won't be able to do the testing, and it's going to cause a ripple in the healthcare system that's just not going to be sustainable. So I know there's a lot of angles to this, but let's just start off with what the risks are. I mean, there's so many toxins out there. There's so many environmental factors, but what we're not talking about those here per se. What we're talking about is genomic stuff, right? Genetic predispositions. So I'd love for you to kind of tease that out a little bit prior to us getting into the whole cancer story.
Sure. Well, I think Angelina really described it best. What she said she was facing when she made this decision to remove her breast prophylactically was greater than an 80% risk over her lifetime of breast cancer. Now, most women have a 1 in 8 chance of developing breast cancer, and Angelina's risk is considerably higher. So that's what tipped the balance for her. She has, as she described it, the faulty gene, and that is the BRCA1 gene, which puts you at a greater risk for both breast and ovarian cancer.
Mm-hmm. Mm-hmm. And so now there's testing that can be done for this. It's not cheap. It's about $3,000 or more, which obviously is an obstacle for many women. But once you've tested positive for this, I mean, for her, it's an 80% chance, which is huge, right? I mean, if those were your odds in Vegas, you'd bet on it every time. And if they're not, or bet against it, right? And so that those are huge odds, right? And so
that's right. Yeah. And I think another important point, Pedram, is that women need more choices, not fewer. And so, the people who are arguing against her making this decision and sort of saying, okay, that's fine, you're in this elite status, you have the money to spend on this procedure. I actually think that women need more choices, not fewer. Men too. So I think it's really powerful that she shared her story so publicly and brought this into the spotlight, because really this is going to come back to things that are near and dear to our heart, which is, how do you create the good neighborhood for your DNA? So it's not so much, that you need to dial in every single gene and what is exactly your percentage risk, but I think we've got to look at this piece of how do you create the best neighborhood? How do you not have the sort of problems that make you spiral down toward cancer and instead have a much more virtuous cycle happening in your body?
Well, amen to that. I mean, that's the stuff that we can really do stuff about, right? I mean, I can't control who I was born to, and the genes that we come in with, but the epigenetic expression of that stuff, that's where, we can actually have an effect on our health and what we can do. I mean, it's arguable that, with this BRCA1 and BRCA2, she could fully express in the negative light and all that. I mean, that's where all the debate is right now. But the point is that we have a lot that we can do to offset some of these tendencies and set up that neighborhood. So maybe we should talk about some of these just kind of key practices that will help clean up the neighborhood.
Yeah, so clean up the neighborhood. Well, if we just start with breast cancer, I think it's so important to realize that we've dialed this in pretty well. Like, we know how you can reduce your risk. And I like to start off by saying we know that 50 to 80% of your DNA and how it's expressed is determined by how you eat, move, think, and supplement. I mean, this is a really major concept that also is in your film Vitality. And so what are some of those things? When it comes to breast cancer prevention, we know that a low-fat diet actually makes a difference. And it's painful for me to even say that because I think fat is so important. But it shows time and time and again that a low-fat diet makes a difference. You can sort of think about the Japanese and how the Japanese have such low rates of both prostate and breast cancer, and fat does seem to play a role with them. Mm-hmm. We also know that fiber is super important. I feel like fiber is the unsung hero. We all need about 40 to 50 grams of fiber a day. And I think of that as a pound of vegetables. Get your pound of vegetables every day. Most of us need some additional fiber beyond that. But Pedram, how about you? You've got some strategies that I know you believe in.
There's so many to look at in terms of just like you said, how you eat, sleep, supplement, take care of yourself and all that. First and foremost, are you hydrated? Are your detox pathways working correctly? And that's something that we see a lot of in clinic as people come in, and a lot of their detoxification pathways. There you go. Exactly. I got mine right here. Right.
Everybody drink your water right now.
Drink your water while you're listening to this. Exactly. And so just keeping it flowing and keeping it through. I mean, the world isn't getting any cleaner. And so we got this brown cloud of mercury coming over from China, and we got, diesel smoke and all sorts of stuff in our own, neighborhoods. So, working and having cruciferous vegetables, having things that will help the liver pull this junk out of the system and out through the bowel or out through the urine, whatever we can do to detox and sweat to get it out. Fantastic. That's the work that we can do on the front end. But, like you had mentioned, it's you make the choices of what goes into your body at the grocery store, and then eventually you make them at home. So it's really what you're buying off the shelves. I mean, I just had Jeffrey Smith over here in the office last week and talking about GMOs and what these kind of nasty foods that are, out there that are frankenfoods are doing to our bodies that are, big question mark, really. A lot of it, we don't even know what's happening, and what we do know is happening is kind of scary. Right. And so, for us and the stance that I would take, like clinically, is always just, go as clean and organic and fresh as you can, and go through every single cupboard in your house and go through all, go to the pantries and all stuff. Just get out all the junk. It's kind of like if you're trying to get out of debt, right? First thing you do is you cut up your credit cards, right? You can't
clear the decks.
That's
Get
right.
all that crap out of your kitchen. I love it. Start a revolution with your grocery cart. Yes.
That's right. And and you and I talk about this a lot. Is you vote with your dollars, right? And so you will vote for not just the good, sustainable companies that are doing good work and providing clean food and just not being jerks in the planet by buying their products and supporting them, but you're also voting for your own health with every healthy item that you're putting into your body, right? And so the front end of all of this, I think, is on the food and the stuff that goes into your body and into your house, into your environment. And then from there, God forbid these types of things come up, then there's interventions and there's complementary types of treatment that will work with certain things. I mean, for Angelina, I mean, she this is all preventative, really. I mean, from what I understand, there was no cancer diagnosis. There was just a predisposition, right? And that's a bold stance, but I mean, that's, again, 80% is a pretty solid number.
It is a solid number. And for the detractors, the people who are criticizing Angelina, I just wanted to share a story. And I hear these stories almost every day in my practice. I have a woman who's 56 years old who is positive for the same gene that Angelina has. And she has been getting mammograms, digital mammograms every 6 months for like 26 years. And she's been getting MRIs of her breasts pretty routinely. She's gone through about 7 biopsies. And every time she has a biopsy, she's got that anxiety that's normal, where you just feel like, oh, this is the time that I didn't escape my fate. So I think it's really important to realize that we want more choices. Like it's really valuable to understand that, you know, these are really good choices for creating the best neighborhood, and they're certainly affordable to buy broccoli as opposed to prophylactic mastectomy. There's quite a difference in terms of the cost. But I also think that it's so important to realize that there's also a cost to all of that diagnostic testing that Angelina needs or other people need who are at greater risk. So that's one piece I wanted to share. I also wanted to dial in a little bit more on the food and drink side, what you can do for preventing cancer. You mentioned the cruciferous vegetables. I love vegetables. I think this is such an important message. But I also just want to give the caveat that if you have thyroid problems, you got to be kind of cautious about it. I don't think the data is very strong, but there's this long history of how raw brassica, raw cruciferous vegetables like broccoli and Brussels sprouts and so on can slow down your thyroid. I think actually this problem is more related to GMO soy, speaking of Jeffrey Smith, but it's important to realize that it may cause a problem. I think overall the benefit is still there from getting all the nutrients that you get from your vegetables, but it's just something to think about if you have thyroid issues. And then can I just say a little something about alcohol?
Please do.
So we know that when it comes to breast cancer, this is such sad news. We know that 3 to 6 servings a week of alcohol is linked to a greater risk of breast cancer. And this is tied to the point you made, Pedram, about the detoxification, because we know that women who drink more, who have more than 3 to 6 servings a week, estrogen in their body will do a backflip and cause problems, lead to damaged DNA, lead to turning off the protective genes and turning on those bad neighborhood genes. And we don't want that. So you want to also modify how much alcohol you're having. This is one of those things that women hate to hear, men too. But my message is drink less, better quality. How's that, Pedram?
Fair enough. Well, you know, some people need, and I'd like to kind of stay on this point for a second. Some people need that glass or two of wine a night to decompress. And for me, I always stop and say, look, it's just because people haven't been taught decompression rituals in our culture. Yes. Right? You grow up in Asia or something, you know, your grandpa taught you how to meditate or do Tai Chi out in the yard, and you know, you grew up somewhere where you could go out and take a walk in the woods. I mean, you grew up in Alaska, you know what it's like to be out in nature. And so a lot of people, I think, do a stress decompression ritual, which cortisol's not your friend, and cortisol, you know, is oftentimes causing all kinds of problems, as you've written about, and is a huge part of the whole hormone imbalance thing with people in stress. And so people try to kind of bring down their stress with alcohol, and I think that there's healthier ways to do so, and ways that will make you feel better in the morning, right?
So true. And, you know, the very thing you think you're getting from the alcohol, it's actually backfiring on the other side. So we know that alcohol actually raises your cortisol. You think that you're using it to decompress, and yeah, it feels a little good when you have a buzz, but it's also robbing you of the sleep that you need at night. You know, you may fall asleep more easily, but the quality is not going to be good. So we need to really look at that. I'm glad you mentioned it. And if you don't have, you know, a grandfather that taught you meditation, learn it on your iPhone. You know, there's all these apps that you can use, and in 5 minutes while you're sitting at the grocery store in line, you know, causing a revolution with your grocery cart, do a little 5 minutes on your iPhone. It'll make a big difference.
Bingo. I know it's something that my wife and I always bicker about. She's like, why do you keep buying all these kooky apps? Right? It's like, they're so great. You know, in the old days, you got to climb up some temple and spend 3 months of your life trying to figure out how to breathe through your belly, and now you can just download it off your phone.
It's so true. You don't have to move to the Himalayas.
It's true, and frankly, I did that. I traveled through the Himalayas, and I'll tell you, you have this kind of pseudo enlightened feeling when you're up there because it's beautiful and everyone's nice. But then when you come back and you're sitting in rush hour traffic and there's smog and like angry people all around you, that's where the rubber hits the road. So if you can't learn to meditate down here, you're screwed because the city is chasing out the Himalayas. It's the city is growing. We got to learn how to deal with stress wherever we're at. And that I think kind of takes us back to the breast cancer topic, which is, these environmental toxins are stressors. Internal stress is a stressor. I mean, this is the neighborhood that you talk about, right? If you're in a upset neighborhood, there's more chance to have things go wrong. And so, one of the things in terms of lifestyle that, we harp on all the time in our content is, happy people are healthier people, right? And just working to get yourself into a place of meaning and purpose and finding the little things that make you happy and not being upset, keeping up with the Joneses or whatever it is that's stressing people out in the neighborhood here. But then it's also the internal dynamics of the environment. So are there herbs? Are there supplements? I mean, is there anything else that you would recommend? I mean, I know on the eastern side of the spectrum, we talk about adaptogenic herbs and the ginsengs and the silkworms and all that kind of stuff, right? And so we've used that for years. What would you recommend to people?
Well, you touched on a really important point, which is the role of stress and cortisol and your adaptability and how that plays in with creating a good neighborhood or the neighborhood that's going to take you down that path toward cancer. So you're absolutely right. In fact, the latest research, I was just talking to the head of psychiatry at Stanford about this particular topic because they've published some studies looking at how women who are breast cancer survivors have what's called a flat cortisol curve. So normally you're supposed to have your peak cortisol first thing in the morning, kind of like, a downhill ski slope from there. That's normal. Peak is within about an hour from waking up in the morning. And breast cancer survivors tend to have this really flat line where they don't peak first thing in the morning. So they have some issues with their cortisol levels, and there's many ways to increase your adaptability. So beyond meditating or using, inner balance on the iPhone or going to a yoga class, there are some adaptogenic herbs. I'm a big fan of rhodiola. That's one of my favorites. My particular issue, which I discovered 10 years ago, is high cortisol. I'm just a bit of a stress junkie. It probably happened in my residency training. I'm sure you know nothing about that, Pedram.
I've never been stressed before in my life.
No, you've never had high cortisol. So I like rhodiola because it helps you adjust your high cortisol. It brings it down into that Goldilocks position of not too high, not too low. But share some of the herbs that you like for creating a good neighborhood.
Rhodiola, the Tibetan rhodiola in particular that I played. I used to play with Ron Teagarden a lot, and they do all the kind of adaptogenic herbs for rock stars and stuff like that. And so, again, now we're kind of talking about high-ended, expensive stuff. It's like you're going to take this BRCA gene thing for $3,000. If you could afford some of these herbs, then awesome, good for you. But I love basic kind of adaptogenic stuff. You could even get an American ginseng that works really well. We've toyed with holy basil for cortisol levels, which seems to work pretty well, like Tulsi teas and stuff like that.
Yes.
Great. One of the things that the Chinese use a lot is just mint. Mint teas. It helps kind of move the liver and clear the liver, and it's worked tremendously well. But again, when I have someone coming in with cortisol issues, first thing I do is ask them, hey, are you moving? Right? Mm-hmm. Because if you're going from office job to home to TV show to, reading on your iPad in bed and wondering why you're not falling asleep, then we have to have a whole other conversation. Right? And so I get them out, I get them moving, I get them exercise in a circadian rhythm where, they're doing it in the morning, and then in the evening they're kind of doing more decompressive stuff. And I find that works really well. Sure, there's pills and potions for stuff, but just that kind of good old healthy living and moving the human animal the way it should, I'm finding is working really well for our patients as well.
Yeah, I love that. And, as usual, you're supported by the best evidence. We know that holy basil, Asian ginseng, rhodiola, they're all supported by randomized trials, and they really show that they create a good neighborhood. And then this whole movement thing, I mean, you raised this whole issue of circadian rhythm that I think is so important, and this is going to be the next 10 years of research. You know, I was talking to Susan Love, who's one of the authorities on breast cancer, and she wrote the Dr. Susan Love breast book that sold millions of copies. And she was saying to me, you know, we used to think of breast cancer as being this cell that would mutate and it would have daughter cells, and over 2 years it would become a lump, or you'd see it on the mammogram. We don't think about it that way anymore. We think about creating the good neighborhood versus the bad neighborhood, and the good neighborhood has a really clear circadian rhythm where you're in bed within a few hours of the sun going down. You're not getting a ton of artificial light at night. You're not, you know, reading the tablet for hours on end, which we know reduces your melatonin, another thing that we see in breast cancer survivors. And so you are catching the angel train. You're going to bed by 10 o'clock, and you're getting up at the same time each morning, somewhere close to when the sun comes up. That sets in your brain, in your pineal gland where you make melatonin, and also between the hypothalamic pituitary adrenal axis, known as HPA for short. That's where you set up your circadian rhythm. And a good circadian rhythm is so important. When you have a dyscircadian rhythm where you are not having it, you're staying up too late, you're on the laptop, whatever it is, you're not moving, you're not getting the bright light that helps you set your circadian rhythm, that's where things start to come unraveled.
What do you, I mean, for me, I'm kind of lucky, right? I live in Southern California. The sun's out. It's beautiful all the time. I mean, you lived in Alaska for a while. I mean, the rhythms get a little funky when you're up in, northern altitudes and stuff like that. I know that there's light boxes and kind of full spectrum light devices that have worked pretty well. For me, what I do here in California is simple. I prescribe camping therapy, right? Get out in the woods, wake up with the sun, do it a few nights in a row, your body will remember, and then, when you come back, stick to it, right? And I just basically ixnay the TV at night for patients and say, look, that's it, no artificial light at night. But what do you do for people who don't really have the kind of natural bounty, or if you will, if it's just freezing and cold all the time and they can't really get out and do stuff like that? Do you have supplements that you recommend?
Well, there are a few supplements that I think are helpful for setting the circadian rhythm. But I actually still think that your point about movement is really important. Even in Alaska, when I was living there, I can think back to when I was 13 years old, and in the wintertime, you get about 18 hours of darkness. So that means that the sun sort of comes up around 11, and then it goes down, by like 5. And so that's not many hours to set up your circadian rhythm, but we would go cross-country skiing. We would go in the darkness. Every golf course in Alaska is turned into a cross-country ski resort. And so we would cross-country ski. We'd go on bike trails, and we would get out, and the movement really helped with setting the circadian rhythm. So yes, you can use light boxes. You can use supplements. I'm a fan of, for people who have like a flat line when it comes to their cortisol levels, I think that licorice can be really effective. You just have to be careful with it because it can raise your blood pressure, as you know, Pedram. And we just know, the vitamin Bs are really important, and getting sufficient omega-3s. Sometimes theanine can be helpful in terms of helping you with focus and with reducing anxiety. So there's lots of different ways to take care of that circadian rhythm. But a big part of it is making sure that you're sleeping at night and you don't have erratic sleep cycles.
And that's that's kind of a big subject, obviously, because I think that people in the Western world are progressively getting worse and worse at sleeping. I mean, you go home with all the worries of the world on your mind, and things cost money, and you keep spending it, and it's becoming an epidemic. And I know you and I are going to be talking about sleep a lot more often. And I still come from the school of thought that I could pretty much sleep anything off. It's just great medicine, and we know now that the melatonin and some of the things that are happening in the brain that are getting out there that are kind of super immunomodulators are coming in and really cleaning up the shop at night while we're sleeping. So if you're not in deep sleep, you're not hitting stage 4, you're not going to some of these places where growth hormone is hitting and some of the things that you and I know biochemically are working. But at the end of the day, where the rubber hits the road is, do you wake up feeling refreshed? Do you wake up feeling better? And if the answer is no, then you got to look at your sleep.
Absolutely. You know, if your first thought when you wake up is either snooze button or how fast can I get some coffee, we need an intervention. So I totally agree with that. And I also think it's important to realize that as you get older, you will fall down a hormonal flight of stairs, male or female, if you don't master your sleep. And as you just said, it is where all the repair happens. All the repair that happens in your body in terms of growth hormone, testosterone, having a repair conversation between your brain and your adrenal glands and your heart, that happens at night. So I think this is a really essential piece, that people master their sleep.
So when we talk about breast cancer and the term hormones, you know, everyone's so freaked out about hormones because they all think that hormones are going to cause cancer and that they got to control things. And obviously if you have, you know, estrogen sensitive ones, that people, you know, everyone's running away from soy and all that. So it's become this huge thing that everyone's freaked out about. Can we talk about that for a second, just in terms of hormone health and cancer?
Sure. Well, it's not so much that any of these hormones are evil or dangerous. It's more that when they're out of balance, that can cause problems. So what I find in my practice is that somewhere around 70 to 80% of women between the ages of 35 and 50 have estrogen dominance. Now, men can have estrogen dominance too, and I'll get to that in a moment. But when it comes to women and breast cancer, we know that estrogen dominance is a risk factor for breast cancer. So how do you measure that? You actually measure on day 21, if you're still cycling or any time after menopause, the ratio between progesterone and estradiol, And if it's less than 100, that means you're estrogen dominant. You can also do it based on your symptoms. And I have a quiz that people can use to figure out if they have estrogen dominance. There's lots of different symptoms, including breast tenderness and moodiness, PMS, also known as pass my shotgun. And so we want to make sure that we've got estrogen in balance. When estrogen is hanging out in the body too long, and that can be purely from the food that you're eating or not eating. If estrogen's hanging out too long in the body and stimulating the estrogen receptors, that's where you have the bad neighborhood that can lead to breast cancer. So we know that, you know, eating commercial meat actually changes your microbiome. It makes more of those bad bacteria that don't love you, that are not your best friend, as Michael Pollan would say. And we also know if you're not getting enough fiber, as we talked about earlier, that can lead to not having estrogen get used and removed, which is what we want. Now with the guys, what's important is your ratio of testosterone to estrogen. And if you have too much estrogen, because it starts to rise as guys get older, and testosterone declines, you can have, you know, the classic symptoms of estrogen dominance. You can have man boobs, love handles, you lose your drive, you may not have as much sexual interest. These are not good. We don't want those things. So we want to manage these ratios for both men and women.
And, you know, that's obviously beyond the scope of what we want to talk about today, but maybe we should do a whole show on figuring out how people can kind of get to that solution. I mean, you'd be saving a lot of marriages with this conversation here.
Well, not just that. There was just some new data looking at testosterone to estrogen ratios and heart disease in men. So, yes, we definitely have to do a whole session on that.
Fantastic. Okay, so just to wrap this up, because I don't want to go too long on this, because I know people are on their drive and are getting where they're getting or whatever it is right now. Long story short,
you're going to go home and meditate.
Go home and meditate, right, exactly.
And de-stress.
De-stress. Eat well, take care of yourself. Angelina is brave for doing what she did, you know, and you know, people have reacted in different ways, guys. But I think I definitely side with what you're saying. Is, you know, I think women need more choices. I think humans need more choices, and it's just one more thing that we can do. Now, if you're talking about myriad genetics and all this kind of like, oh, they're going to force this stuff on the government, and there's all sorts of talk out there, right? And I just, you know, at the end of the day, you and I can only look at this as clinicians and say what's best for the patient. I don't want to get into the politics of any of this, right? And what's best for the patient is the sooner you know, the better. And if you know your odds, then you know how to live your life accordingly. But for those of you who could say, okay, I'm going to go take this test, I'm going to spend the $3,000, and it turns out that the BRCA gene isn't an issue for me. It doesn't mean, Little Debbie's and Oreos and six-pack of beer every night, right? Because you're going to set up a neighborhood that's still going to screw it up, right?
You still need a good neighborhood, even if you don't have the cancer genes. Absolutely.
Yeah, I mean, you're just don't mess with it. Don't tempt fate, right?
Well, exactly. And, just a quick stat on that. We know that 80% of women who develop breast cancer don't have the genetics that put them at increased risk. So we're talking to, 80% of people still need to create the good neighborhood. It's really important.
Yeah, absolutely. And I think next week we'll kind of segue into this, because next week we're going to do a segment on autism and some of the environmental toxins out there and some of the increased chances of developing some of these things. And again, guys, it's environmental. It's how we live. And so that's, I don't think we could hammer that point home hard enough. It's how we live. And so the cleaner you can live, the healthier you are, the more you're aware of your neighborhood, the better. Sarah, I know you have a hormone quiz, so I'll get the URL from you and we'll post it with this so that we have, people can have the tools and everything that they need for this. Anything else that you have in terms of resources and things that could be helpful for people on this particular topic?
Well, this is one of those topics I won't shut up about because I think it's so important. And I would just add that we talked last time about endocrine disruptors, and we're going to talk again about those. It's sort of a thread through all the conversations that we have. And just a reminder, some of the things we talked about last time, especially the thyroid plays a key role when it comes to prevention of breast cancer and prevention of other types of cancer. It rules the metabolism in your body and how fast or slow you burn calories. We talked last time about getting an organic mattress, if you can afford it, as a way of avoiding some of those thyroid disruptors. And I just wanted to check in. Has anyone gotten their organic mattress? That's the last little piece I wanted to add on.
Awesome. Yeah. At the end of the day, guys, we're not doing this till we're blue in the face for no reason. We're doing this to help you guys. And so do it, feel the difference, feel better, and you'll know. One of the topics we did talk about is increased release of toxins once people lose weight and how that slows down the thyroid. There's some more on that I'll bring up for a subsequent conversation as well. So there's a bunch of cool stuff that I think, I just don't get to see your face enough. We'll keep doing this. So, okay, Dr. Sara Gottfried, one of my favorite people on the planet. Always a pleasure. I look forward to our next encounter. So we're on to do this weekly, right?
You got it. You got my commitment, Pedram. You're one of my favorite people, too. So thanks, everybody.
Thank you. See you guys soon.
All right. Bye.
Bye.